You've probably been told if your doctor prescribed it, it's safe. I believed that too, for a long time actually, until I started seeing the same patients return to my operating table. Heart attack, stroke, cardiac arrest. Men and women in their 60s and 70s who did everything right, took their pills every morning, followed the instructions, trusted the system, and every single time, the same medications were sitting in their daily pill organizer. I spent over 20 years operating on hearts that didn't have to fail. Today I'm going to tell you about 5 common medications that dramatically increase the risk of heart attack and stroke in people over 60. This isn't about scaring you. This is about giving you the information your doctor may not have time to explain, because knowledge, quite literally, can save your life. Here's something most people don't realize. When a drug gets approved, it's tested mostly on younger adults, healthy ones, people in their 30s and 40s. One condition, no other medications, and a liver that processes everything efficiently. But that's not you, and that's not most of my patients. By the time you reach 60, your body handles medication completely differently. Your kidneys filter more slowly. Your liver metabolizes drugs at a fraction of the speed it used to. What a 50-year-old can handle without blinking can push a 70-year-old into a cardiac event. Does that surprise you? It surprises most people when I tell them. Here's another thing. The average American over 65 takes 4 to 5 prescription medications every single day. Some take 8 or 10. Each one was probably prescribed for a good reason. Blood pressure, arthritis, depression, allergies, diabetes. But here's the uncomfortable truth. Most of those drugs were never tested together, in combination, in an aging body. The interactions between them can be unpredictable and sometimes dangerous. I'm not saying your doctor made a mistake. I'm saying the system wasn't designed with your specific situation in mind. That gap between prescribed correctly and safe for you specifically is exactly where cardiac emergencies hide. So, let's talk about the 5 medications I see most often linked to heart attacks and strokes in my older patients. Pill number 1. The painkiller that's hurting your heart. NSAIDs, non-steroidal anti-inflammatory drugs, ibuprofen, naproxen, diclofenac. You can buy most of them at any pharmacy without a prescription, and that is exactly what makes them so dangerous. When you're 65 and your knees ache and your back hurts, reaching for ibuprofen feels like the obvious answer. Harmless, right? It's over the counter. It's been around for decades. Here's what's actually happening inside your body when you take it regularly. NSAIDs cause your body to retain sodium and water. That raises your blood pressure. In an older heart that's already working harder than it used to, elevated blood pressure is like adding weight to an engine that's already running hot. On top of that, NSAIDs interfere with the protective lining of your blood vessels. They make platelets stickier, more likely to clump together, more likely to form a clot. A clot in a coronary artery is a heart attack. A clot in a cerebral artery is a stroke. Studies show that regular NSAID use in people over 65 increases the risk of heart attack by up to 50%. 50%, not a small number. So what should you do if you're in pain? Talk to your doctor about acetaminophen. It's much gentler on the cardiovascular system. Physical therapy, topical creams, certain lifestyle changes can make a real difference. Pain management doesn't have to come with cardiac risk. Pill number 2. The diabetes medication with the hidden cardiac side effect. An older class of diabetes drugs called sulfonylureas, names like glienlamide, glyphosate, glypiride. These drugs work by forcing your pancreas to produce more insulin. Sounds reasonable, but here's the problem. They do it whether your blood sugar is high or not. That means they can push your blood sugar too low. This is called hypoglycemia. In a younger person, hypoglycemia feels unpleasant, shaky, sweaty, dizzy. You eat something, it passes. In a person over 65, hypoglycemia can trigger a cardiac arrhythmia, an irregular heartbeat, and an irregular heartbeat in an already vulnerable heart can spiral into something much more serious. Here's what really concerns me. Many of my older patients don't even feel the classic symptoms of low blood sugar anymore. The warning system gets blunted with age. They walk around with dangerously low glucose, and their heart is paying the price without them knowing it. Are you or someone you love taking diabetes medication? Ask your doctor specifically about hypoglycemia risk. Newer diabetes medications like the SGLT2 inhibitors actually have proven cardiovascular benefits. There are better options available today. You just have to know to ask. Pill number 3, the antidepressant your heart didn't sign up for. This one is harder to talk about because depression in older adults is real. It's serious, and medication genuinely helps millions of people. I want to be very clear about that. But there's a category of antidepressants that deserves a serious conversation. Tricyclic antidepressants, TCAs, drugs like amitriptyline, noraline, duoxepine. They've been around since the 1950s. In some cases, doctors still prescribe them for depression, for nerve pain, sometimes even for sleep. Here's what they do to your heart. TCAs interfere with the electrical system of the heart, the system that controls your heartbeat. In a young, healthy heart, the body can compensate. But in an older heart, that interference can cause QT prolongation, a disruption in the heart's electrical rhythm that can lead to a dangerous arrhythmia called torsade de pointes. That's a French term. It means twisting of the points. It describes the way the heartbeat looks on an ECG when it goes dangerously off track, and it can cause sudden cardiac arrest. Now, even some SSRI, the newer antidepressants, carry a degree of cardiac risk in elderly patients. Citalopram, for example, has a well-documented effect on heart rhythm at heart doses. I'm not telling you to stop your antidepressant. Please don't do that without talking to your doctor first. What I am saying is, if you're over 60 and taking any antidepressant, ask for a baseline ECG, a simple heart tracing that takes 5 minutes and could tell you everything you need to know about how your heart is handling that medication. That one conversation could save your life. Pill number 4, the everyday allergy pill with a surprising dark side. Quick question. Do you keep antihistamines in your medicine cabinet? Most people do. Dienhydramine, that's the active ingredient in Benadryl and many over-the-counter sleep aids. These are first-generation antihistamines, and they've been around so long, most people assume they're completely harmless. They're not. Not for everyone, and especially not for people over 60. First-generation antihistamines also affect the heart's electrical system. Just like the TCAs we just talked about, they can prolong the QT interval. And when you combine them with other medications that do the same thing, the risk multiplies. Antidepressants, certain antibiotics, some antifungals. Combined with antihistamines, that combination becomes far more dangerous. But there's something else. Dienhydramine blocks a key neurotransmitter that helps regulate heart rate. In older patients, this can cause a rapid or irregular heartbeat, especially at night when the body is already in a more vulnerable state. And here's the part that really gets me. Dienhydramine is marketed as a sleep aid. Seniors reach for it because they can't sleep, and it ends up stressing the very organ they're trying to rest. The good news: second-generation antihistamines, loratine, cetiazine, don't cross into the heart's electrical system in the same way. Same allergy relief without the cardiac risk. Small swap, big difference. Pill number 5, the cold medicine that spikes your blood pressure. I want you to think about the last time you had a stuffy nose. What did you reach for? Chances are something with pseudoedrin or phenylphrine in it, Dayquil, Sudafed, countless cold and flu combinations. For a healthy 40-year-old, they work fine. But here's what decongestants actually do. They work by constricting blood vessels in your nasal passages. That's how they reduce congestion. The problem is they don't just constrict vessels in your nose. They constrict vessels everywhere, including the ones supplying your heart. In someone with already elevated blood pressure, this can cause a sudden, dangerous spike. Pressure increases that can strain the heart wall, trigger an angina attack, or, in the worst cases, precipitate a full cardiac event. I've had patients come through my doors after what they described as just a bad cold. They took something for the congestion, their blood pressure shot up, and they ended up in emergency surgery. If you have hypertension, heart disease, or any history of stroke, please read every cold medicine label before you take it. Saline nasal sprays, steam inhalation. They can manage congestion without touching your blood pressure at all. Now here's where it gets really serious, and I need you to pay close attention to this part. We've talked about 5 medications. Each one carries its own cardiac risk. But what happens when you're taking 2 of them at the same time, or 3? This is called polypharmacy, and it's one of the biggest silent conditions in elderly medicine today. Let me paint you a picture. A 72-year-old woman. She takes ibuprofen for her arthritis, an antidepressant for low mood, and occasionally grabs a Benadryl to help her sleep. 3 medications, each prescribed or chosen for a completely legitimate reason. But together, the ibuprofen is raising her blood pressure. The antidepressant is affecting her heart's electrical rhythm. The Benadryl is adding to that electrical disruption and spiking her heart rate at night. Her cardiovascular system is under assault from 3 directions simultaneously, and nobody connected the dots. This is not a rare scenario. I see versions of this every single week. The interactions between these drugs are not always obvious. Even experienced physicians can miss them. That's why medication reviews, where a doctor or pharmacist looks at everything you're taking together, are so critically important after 60. Do you know every single medication you are currently taking, including over-the-counter pills, supplements, and vitamins? If the answer is anything other than an immediate yes, that's your first action item. I know this has been a lot of information, and I don't want you to walk away feeling scared and helpless. That's not why I'm here. So, let me give you something concrete. First, make a complete medication list. Every prescription, every over-the-counter pill, every supplement. Write them all down on one piece of paper. This single document could be the most important health tool you own. Second, ask for a medication review. Many pharmacists offer this for free. A good pharmacist will look at your entire list and flag any dangerous combinations. Don't wait for your doctor to suggest it. Ask for it yourself. Third, have the conversation. Next time you see your doctor, say these exact words. I'd like to review whether all my current medications are still the right choice for my age and my heart. A good doctor will welcome that question, and if yours doesn't, that tells you something important too. Fourth, never stop a prescription medication suddenly on your own. Any changes need to happen with medical supervision. You are not powerless here. You are an active participant in your own health, and the more informed you are, the better the decisions you and your doctor can make together. I've been a cardiothoracic surgeon for over 20 years. I've held a beating human heart in my hands. I've repaired arteries the width of a pencil. I've stood in operating rooms at 2 in the morning trying to save someone who had no idea they were at risk. And here's the truth that I cannot stop thinking about. Most of the cardiac emergencies I see in patients over 60 are preventable. Not all of them, but most of them. The heart attack that came after years of daily ibuprofen. The stroke triggered by a blood pressure spike from cold medicine. The sudden arrhythmia in a patient who had been taking the same antidepressant for 15 years without a single cardiac check. These weren't random. These weren't inevitable. These were the result of a gap between what was prescribed and what was actually safe for that specific person at that specific age. And the hardest part? Most of those patients were doing everything they were told. They weren't being reckless. They were being responsible. They just didn't have the information they needed. That gap is why I make these videos. Not to replace your doctor, not to frighten you into throwing your medications away, but because I believe deeply that an informed patient is a protected patient. Your heart has been working for you every single second of your life, every beat, without being asked, without taking a day off. The least we can do is pay attention to what we're putting into the body that surrounds. Because the next patient on my operating table doesn't have to be you. So, 5 medications, 5 real risks. Let me give you a quick recap before you go. NSAIDs like ibuprofen. They raise blood pressure and increase clot formation. Older diabetes medications like sulfonylureas. They can trigger dangerous drops in blood sugar and cardiac arrhythmias. Tricyclic antidepressants and some SSRIs. They interfere with your heart's electrical system in ways that become more dangerous with age. First-generation antihistamines like diphenhydramine, disrupting heart rhythm and hiding in products most people consider completely harmless. And decongestants containing pseudoephedrine or phenylphrine. They constrict blood vessels throughout your entire body, not just your nose. And when 2 or 3 of these combine, the risk doesn't add up, it multiplies. One thing I want you to do before you close this video, just one. Write down every medication you are currently taking, every single one. Put it on one piece of paper. Take it to your next doctor's appointment. That one piece of paper could change everything. I also want to hear from you. Have you or someone you love experienced an unexpected reaction to any of these medications? Leave a comment below. I read them, and your story might help someone else recognize a warning sign they would have otherwise missed. If this video gave you something valuable, share it with a parent, a spouse, a friend over 60, someone who takes a daily pill organizer full of medications and has never once questioned what's inside it. That share might be the most important thing you do today. If you want to keep learning how to protect your heart as you age, subscribe, because next week we're going to talk about the 5 symptoms that look nothing like a heart attack, but are. You've made it this far. That tells me you take your health seriously. Good. Keep doing that. Your heart is worth fighting for, and so are you. One last thing. Everything I've shared today is based on current cardiology research and my clinical experience. But it's general information, not personal medical advice. Every person's situation is different. Before making any changes to your medications, please talk to your doctor or pharmacist first. They know your full medical history. I don't. And that context matters more than anything I can tell you.